Hi everyone, my name is Darie. I am a nurse practitioner and I'm going to speak to you today about the appropriate use of antibiotics.
Miss Darie? Nurse practitioner Darie? Achoo! I am so glad to see you. Quick, I need an antibiotic. I am coughing. I'm sneezing. My throat hurts and I feel like I'm going to upchuck any second. Come on, you have to help me.
Okay, Miss Enza, tell me what's happening and I'll do whatever I can to make you feel better.
Okay, Darie, this is what I need. I need a Z-Pack!
You need a what?
A Z-Pack! You know, zithromycin antibiotic, the 5-day thing. I need it and I need it now!
Okay, Miss Enza, I can hear you coughing and sneezing, but tell me, when did this start?
Yesterday.
Okay, do you have any fevers?
No.
Any colored mucus?
No.
All right, let's see. Let me just feel right here. Okay, well, you do have some lymph node swelling.
I knew it. I'm a goner. How much time do I have, Dar?
Oh, no. It's normal. It's just a sign that your body is trying to fight off an infection by using your own immune system. Now, let me take a look in your throat. Say ah.
No.
Why not?
Because you're going to stick that stick down my throat and make me choke. You better not, because if you do, I might just puke all over your clean white lab coat. Hee.
No, all I want you to do is say ah. Come on, just say ah.
Nope.
Now, you know I would never do anything without asking you first and telling you what I'm going to do. Come on, say ah. Well, look, we'll say ah together, okay? We'll sing it together, okay?
Well, I do like to sing. Okay.
All right, we'll sing our favorite song. You ready? On the count of 3. 1, 2, 3. The hills are alive. Okay, very good, Miss Enza. Now, I'm going to take a listen to your lungs and just take 2 really deep breaths. 1 and 2. Okay, very good. Now, let me take a look in your ears and well, I would take a look in your ears, but you don't seem to have any.
What? I don't have any ears?
Oh, never mind. Now, you do not need an antibiotic. What you have is a cold, which is a virus, and viruses get better on their own without the use of an antibiotic. Now, on the other hand, bacterial infections are infections that do require an antibiotic to improve.
Well, how do you tell the difference between a virus or a bacterial infection? And how come I always got antibiotics before? You know, Dar, I cannot afford to be sick. I have a very, very busy life. You would not believe how busy my life is.
I know, Miss Enza, but if you take medications when you don't really need them, you can make yourself even sicker. You could have vomiting,
Ew.
diarrhea.
Okay, I definitely do not want that.
And do you know about 250,000 people a year get something called C. difficile, which is a really...
Do I really need to hear this? La, 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 la.
It's a really bad infection that causes diarrhea.
I knew I didn't want to hear about this.
But it's important for you to know what serious problems can occur when you don't use antibiotics properly. And if they're not prescribed properly either.
You mean there's more?
Oh, yes. Did you know that sometimes people don't finish their antibiotics? They just stop them when they start to feel better. And then they take them again when they feel sick. And sometimes they'll give them to a friend if their friend feels sick, and that is not good.
It's not?
No, because if people don't take antibiotics the way we prescribe them, then they can get even sicker. And, you know, patients shouldn't really do that, and prescribers shouldn't give medications that patients really don't need. If we continue to do this, bacteria will just continue to grow, and it'll get stronger and stronger until eventually they'll be so strong that there will be no antibiotics left to get rid of them.
So that means...
It means that people will just get sicker and sicker, and not just here. It'll happen all over the world, and things will just get worse and worse, and, you know, I have to say, sometimes it's very difficult to tell if somebody needs an antibiotic or not, but we have tests that can help us solve that solution, and that's by doing blood work or a throat culture.
Okay, I get it. So I have a virus, but I really don't feel so good. So then, what can I do to feel better?
Well, you can take some over-the-counter cough syrup for your cough, and how about an antihistamine to help with that congestion that you have?
Okay, but no antibiotic, right?
Right. Because
viruses get better all on their own, and not only bacterial infections need antibiotics. Right, Dar?
That's right, Miss Enza. That's absolutely right. And if you don't start feeling better, you can always call me and we'll talk about how you're feeling.
You know what, Dar?
What, Miss Enza?
I love you.
Oh, I love you too. Now, let's go out and spread the word about the seriousness of overprescribing antibiotics and remind providers and patients about carefully taking these medications.
And remind patients to trust their provider. And if they tell you that an antibiotic is not necessary, listen! Besides, you can always talk and call to talk to them if they're not getting better.
That's right. We're in this together, right, Miss Enza?
Right. Hey, Dar, you could call me by my first name.
Oh, well, thank you.
It's Influ.
Influ? Wait, your first name is Influ?
Uh-huh.
Your name is Influenza?